One of the things you told me before, that some of the harmful pathogens have the ability to manipulate your brain chemistry that make you crave the things they want to eat. Now, I'm wondering, is that specifically to fungus, or does that include other types of harmful pathogens besides candida and fungus?
Well, it's mostly through that liver mechanism that we see, because we see liver dysfunction, we see type 2 diabetes, you see elevated cholesterol. Those are also symptoms of fungal infection, because when you treat for fungus, those go down. I'm not talking about diflucan, that won't do it. You have to treat in a comprehensive way that works. That's really the center of appetite. Your brain will give you the hunger signals, whether to eat or not, to some degree. But I'm talking about appetite, which is, you like strawberries, I like raspberries. That's a chemical difference between us. It has something to do with who you are genetically and what you were exposed to as a child and so forth. Kids hate vegetables, often as teenagers. Now suddenly they're good. It's a chemical change. It's not that the vegetables changed. So that's mostly a liver issue. It's hard to, you just feel it, but we know that it comes from the liver. And interestingly, when you do effective treatment for fungus, as you stated, usually within 48 hours, those cravings for most people are down to almost nothing, or they're gone, or they're just much more manageable. And this is not by taking appetite suppressants. Those particular cravings go away, and yet your appetite might become more healthy, and you actually have a better appetite. So the effect on the brain from the fungus is interesting. The effect on the brain is from the liver having difficulty and not detoxifying the blood like it is supposed to do. So we run on blood. All of our organs and everything run on blood, not just the oxygen in the blood, but the nutrients in the blood and the wastes in the blood if they're not taken out. And we're not just talking about metabolic waste excess. We're talking about hormones and things that have to be deactivated and taken out of the circulation. This is what the liver is designed to do, and it does, unless it's bound up with infection and is not working properly. Now, this is going to be new for a lot of people. They've never heard of it. Cholesterol is an infectious problem. It is. When we treat for fungus, boy, 90% of the time, if we don't see that cholesterol go down, that's quite a surprise. And I think over 90% of the time we can say that it goes down and usually normalizes, to the point that we have to take the people off the statins, otherwise their cholesterol is going to be way too low.
Right. That was my experience. I know that my cholesterol was elevated to the point that I had doctors in the States wanting to put me on cholesterol medication. But fortunately, by this time in my life, I understood that it was a liver problem. And so when you explained this to me a couple of years ago, it made sense, and so I'm thankful I never did go on the liver medication.
Right. Have you measured your cholesterol since?
Yeah, it's normalized.
Great.
Yeah.
Okay, there you go. That's just so typical. I was going to mention that as the blood is not properly cleansed by the liver, now the kidneys help also, and science points out that the favorite organ of candida is the kidneys, so there's an effect there too, but most of the visible things that we can measure or observe are from liver effects. But when that blood has lots of extra things in it, which may be aldehydes or various other chemicals, you end up having brain problems. It tends to be irritative to the nervous system, which could mean that you're irritable. It could mean that you're having memory problems, difficulty organizing things, can't remember why you went somewhere, having to use a lot of stickies. It can be bad handwriting. The hand gets so shaky. The heart racing, a number of things like that affect the nervous system, even numbness, which is a little hard to understand, but that's definitely a symptom also, that in the fingers or the legs can happen. So you get these brain effects. Worse than that, though, you'll get headaches. Now, when you go to the neurologist, he'll give you a list of fermented foods to avoid if you got migraines. He will mention chocolate and aged cheese and wine and various other things like that. They're not categorized by him as fermented foods, but that's the common element among all of those. These are fungal feeders, and this is a primary cause for migraine. Other things are depression, as I mentioned, irritability, various other kind of not so pleasant. Panic and anxiety. Anxiety attacks, panic, This is fungus.
Really?
When you treat it, they go away, and
How
they go away
many?
rapidly.
That's amazing.
It is. But again, you know, you and I are both old enough to remember back before in the 70s who had panic attacks, who had
Right.
anxiety.
Yeah.
You know, unheard of.
For
Now, they
sure.
existed, but not nearly at the level where they are today.
Okay. Approximately how many different types of fungus is there?
Well, there are thousands of types of fungus. And when we say fungus, we should be talking about yeast, mold, which is a collection of yeasts or fungus. There are subtle differences between mold, fungus, and yeast, but for our purposes, they're essentially all the same. They're that you have viruses, and then you have bacteria, and then you have the yeast or the fungus category, and then there are some other larger things like protozoa and so forth. But that they all fit in about the same category. The word we often use is candida, meaning Candida albicans, and this is probably the most predominant species of fungi that you would naturally find in your body. And what we're referring to when we say you have candida is that you have an overgrowth, you have too much, you have more than would naturally be there. And we're also saying that it has left its normal area, which would be mostly the intestines, and has invaded into the liver and other organs. So it's existing in organs where it should not exist. That's what we mean. So Candida albicans, or to say you have candida, means you have a general overgrowth of different types of fungi. Candida probably the main one. Does that make sense?
Okay. Yeah. I just wondered, that's the primary one that causes the cravings?
That I don't know. I just know that it's a general overgrowth. Let's just say they're all partners in crime.
Okay.
And they're all causing a problem. But that would be hard to tell also. Microbiologists would probably have to answer that. And then it's difficult to culture out which one is actually causing the greater problems. But the general principle is true, that it's no longer in the area of the body where it was supposed to be. It's in greater amounts, and it's left its normal environs and become invasive.
Okay. All right, we're getting close to another 10-minute segment, so we ought to probably stop it here, and then we'll move on to another subject, and then they can splice this part out.
What else do you want to do in the last 10 minutes? What do you want to accomplish? It'd be nice to talk about the treatment and how it works.
Yeah, I wanted to find
how well
out
it works.
If we could address your protocol, your whole kit that you sell,
Okay.
and that I have on my website, because I'm always getting phone calls, people asking me to explain it to them, and
Right.
I can't begin to explain it as well as you do. So if you
Okay.
would explain what's in the kit and how it affects you.
Okay. So Candida treatment requires three things. It requires medicine that's going to kill fungus. Now this is really hard to come by because Candida is a very versatile, resilient, tenacious, entrenched organism. It knows how to survive. When you think of virus, very, very small, very smart, but very small. You can kill it with oxidation. Bacteria, we can find ways of killing bacteria. We go to the fungi, because bacteria and fungi are competitors. And so we take fungal products like penicillin, named for Penicillium mold, and we use those same chemicals that fungi use, and they will adequately kill off bacteria. Because it works in nature, that means it works in us. But what do we use to kill off fungus? Well, there are a number of medications on the market, a number of them. They all work by the same mechanism, which is to inhibit the ability of the fungus to actually make its cell wall and to actually cause holes to develop. We call it ergosterol synthesis. And hopefully then the contents of the cell will spill out and the fungus will die. Well, that has some effectiveness, but seeing as all the medications work in the same way, once these very intelligent fungi are able to work their way around it, you've got very little effectiveness left.